Welcome to the 2015 ASHP Foundation Literature Awards presentation. Since 1971, the program has recognized 650 authors and 155 articles published in the biomedical literature. Let's meet the latest awardees to join this prestigious group. The Student Research Award goes to Jackie Ho and her colleagues at Touro University College of Pharmacy in Vallejo, California. Their article, Implementation of an Accelerated Physical Examination Course in a Doctor of Pharmacy Program, was published in the American Journal of Pharmaceutical Education.
With the passing of the Affordable Care Act, pharmacists are afforded more opportunities to provide services directly related to patient care and outcomes. To meet the growing demands of the primary care shortage, pharmacists must have a comprehensive understanding of physical assessment. These skills will enable a complete and accurate patient evaluation, enhance interdisciplinary training and interprofessionalism, and facilitate professional advancement. Our research group designed an accelerated physical assessment course using the innovative flipped classroom approach. This course was successful in improving pharmacy students' knowledge and confidence in using head-to-toe physical examination skills in pharmacy practice. Improved confidence in communication with other healthcare professionals was also observed. We hope that this physical assessment training course will be adopted by other schools of pharmacy in a proactive approach to further develop the professional skills of their students and ultimately enhance the impact that pharmacists can have on health and wellness.
The Pharmacy Practice Research Award goes to Lindsay Amarine and her colleagues at the University of North Carolina Hospitals in Chapel Hill. Their article, Assessment of Final Product Dosing Accuracy when Using Volumetric Technique in the Preparation of Chemotherapy, was published in the Journal of Oncology Pharmacy Practice.
The gold standard method for preparing chemotherapy in hospitals and clinics is through volumetric preparation. However, the Institute of Safe Medication Practices, ISMP, does not recommend volumetric preparation for chemotherapy. This recommendation is based on case reports and a few retrospective studies, but no observational study had been conducted. Our observational study was conducted prior to the ISMP recommendation. The results demonstrated that while the mean deviation of dosing accuracy using the volumetric technique was minus 0.53%, the deviation range is highly variable, with only 87.4% of prepared doses being within plus or minus 10% of the ordered dose. Our study demonstrates that the process of using volumetric technique alone is not sufficient to accurately prepare chemotherapy medications. Our article has generated vast discussion within pharmacy and oncology communities, as well as the medical technology and medical device companies. Hospitals are changing their practices based on our results and finding new ways to improve the accuracy of chemotherapy. This original research supports ISMP's recommendation to not use volumetric technique alone for chemotherapy preparation.
The Drug Therapy Research Award goes to Charles Leonard and his colleagues from the University of Pennsylvania in Philadelphia. Their article, Empiric Potassium Supplementation and Increased Survival in Users of Loop Diuretics, was published in PLOS One.
Loop diuretic therapy is common in the millions of persons with heart failure in the United States. Despite a sound theoretical basis for empiric potassium supplementation in users of furosemide, we were aware of no prior studies examining whether this practice improves survival. Given this, existing clinical practice guidelines have been forced to rely solely on expert opinion. We wish to fill in this knowledge gap. Our cohort study, nested within a Medicaid population, demonstrated that empiric potassium supplementation appeared to reduce mortality by 7% in patients who receive furosemide at a dose of less than 40 milligrams per day, and by 16% in patients who receive furosemide greater than or equal to 40 milligrams per day. To contextualize the latter finding, about 70 patients on high-dose furosemide would need to be empirically supplemented with potassium to prevent one death within the first year of loop therapy. This represents a clinically important yet plausible improvement in survival. Potassium supplementation may be a relatively inexpensive way to prevent death in loop-treated heart failure patients.
The award for innovation in pharmacy practice goes to James Hoffman and his colleagues from St. Jude Children's Research Hospital in Memphis, Tennessee. Their article, P-Gene for Kids, a model for the clinical implementation of preemptive pharmacogenetics, was published in the American Journal of Medical Genetics, Part C, Seminars in Medical Genetics.
The best practices to implement pharmacogenetic testing are still emerging, and so genetic tests are not being used as much as they could be to help decide which drugs and doses are right for a patient. At St. Jude, a pharmacist-led team is working to implement preemptive pharmacogenetics across our hospital. Our efforts are organized under the P-Gen for Kids protocol. In this paper, we give an overview of our work as one model for other pharmacists interested in this innovative area. We describe the steps to implement preemptive pharmacogenetic testing, such as organizational planning, the genotyping platform, patient and clinician education, and how to incorporate results into the electronic health record with clinical decision support. We found that after preemptively genotyping over 1,000 patients, 78% of these patients had a result in their record that would change drug therapy. This was with only 4 genes, and today we have 6 genes in routine use through the P-Gen for Kids protocol, and so the patient safety benefits of our work continues to grow.
And this year's award for sustained contributions goes to Joseph T. Hanlon of the University of Pittsburgh in Pennsylvania. Dr. Hanlon is a tenured professor of geriatric medicine with secondary faculty appointments in pharmacy and epidemiology. He is also a health scientist with the Geriatric Research Education and Clinical Center at the VA Pittsburgh Healthcare System.
What drove me to conduct research and publish the findings over my career was trying to find answers to questions such as what drugs do older people take, what are the outcomes of such drug, and if suboptimal, what interventions could be conducted to optimize medication use in older patients. The overall goal was to better understand and improve pharmacotherapy for older adults.
Congratulations to all of this year's ASHP Foundation Literature Awardees.